Hello, my name is Dr. Michael Heke, and I'm the Chief Science Officer for AT Venture Center and all its subsidiaries, including Resilie. So my background is in stem cell biology. I started doing stem cell research well over 20 years ago, and at first I was interested in very basic research about stem cells, and soon became more keen to actually focus on the potential of clinical translation. Today I want to talk about a little bit that came to my surprise, that we actually transgressed even into cosmetics and aesthetics. So I have the tremendous honor to be bookended by two amazing women, our CEO, Erin Crowley, who just presented a little bit about the mission of our company, and I will hand it over a little later to our Chief Medical Officer, Dr. Corinne Cecchetti, who will actually close out by showing you some results of a preliminary study that we entertained. And we have great results achieved with that. As I said, I want to tell you a little bit about exosomes. And exosomes are, as probably most of you know, are nano-sized extracellular vesicles that are secreted by most cells. Virtually all cells do that, and they are experts in intercellular communication, cell-cell signaling, and they have a particular capacity to actually modify immune responses and to trigger tissue repair, which makes them so interesting for cosmetic application. Also in particular for applications that are topical, that address skin issues. So other than typical remedies like moisturizer, for instance, they help the skin, but only as long as you keep moisturizing. So if you, for instance, have dry skin, you keep moisturizing, the skin looks great, but once you actually stop using the moisturizer, the skin gets dry again. On the contrary, when you utilize exosomes for more systemic application, you actually achieve physiological changes for the skin texture. So they are able to mediate tissue regeneration and rejuvenation even, afford you a more lasting effect through these treatments. Exosomes are experts in cell-cell signaling and cell communication in general, and as such they have a variety of roles. As you can see here, there are listed a few of the hallmarks of exosomes, and you will also notice that there are a few that actually not necessarily desired, like triggering metastatic responses, or apoptosis, which is also not desired when we are talking about rejuvenating our skin. So it's very important to carefully consider what kind of exosomes you are actually using. So the first thing you actually have to ask yourself, if virtually all cells secrete exosomes, what kind of cells do you want to use for our applications? And the answer is relatively simple. You want to use stem cells because stem cells are the building blocks of life, and therefore they're most suited to actually use them as a source for our exosomes in cosmetics and aesthetics. Here's like a brief overview of the kind of stem cells that you can have, and above the dotted line you see the most potent of them all. They are our famous or infamous embryonic stem cells that are considered the most potent because they can differentiate virtually all cell types. And there are also iPS cells. Those are reprogrammed somatic cells that are very similar to ESCs without the ethical controversy that's inherent to them. Even though they are the most potent stem cells that you can find, they are no longer considered suitable for any kind of applications, however. One reason is certainly the ethical controversy that surrounds embryonic stem cells in particular, but there's also an issue with them potentially causing teratomas. So these are benign cancers that can be triggered by pluripotent stem cells just because they are so potent that they're hard to control. So what you want to use is multipotent stem cells, like tissue-derived stem cells or progenitor cells. These are typically have their applications in regenerative medicine and beyond, and those are the ones that we want to focus on as well. Among those tissue-derived stem cells, we are focusing on mesenchymal stem cells, and for a particular reason. They are inherently immunoprivileged, so they lack certain surface markers that would potentially cause rejection by the recipient, and they are therefore the most suitable stem cells we can use for any given application. And for these mesenchymal stem cells, we have a number of potential sources as well. Here at the bottom, you see bone marrow and adipose tissue. They are considered less potent, and I will tell you in a moment why that is. And then you have the three areas on top. They are perinatal tissue-derived stem cells or mesenchymal stem cells that are more suited to what we try to accomplish. And among them, we're utilizing, personally, the umbilical cord-derived mesenchymal stem cells derived from the Wharton's jelly, because even within the perinatal tissues, there are differences. And the Wharton's jelly is not only known to feature an abundance of mesenchymal stem cells, but they're also having a property that we call H0, which is very important of what we're trying to achieve. And I will tell you in just a moment what that actually means. There's a variety of potential sources for stem cells, but we are definitely focusing on Wharton's jelly stem cells, mesenchymal stem cells, and exosomes derived from that, because they are the most potent cell that we can think of. When we do harvest those mesenchymal stem cells, we observe a strict policy of low passage. That means we cannot passage them more than 4 times. 4 times means it's basically a recommendation by the International Society of Stem Cell Research, and it is postulated as a threshold that after 4 passages of your cells, meaning the length of cultivation, culturing to expand them, after those 4 passages, you can be reasonably sure that you still have the exact kind of cell that you harvested originally. So the longer you culture them, the higher the risk for transdifferentiation is, or for contaminations and even mutations, something that you definitely want to avoid. This is just like a picture from our umbilical cord, and you see that there's a number of potential sources for mesenchymal stem cells, and the Wharton's jelly is the one that we focus on because they feature low immunogenicity, and it's an easy harvesting procedure and in vitro amplification, and as I said, they are zero-aged. Now, zero-aged, I mentioned that a few times, and here's a slide that depicts why it's so important. You see how dramatically our stem cells decrease in our bodies once we are born. So a newborn has an abundance of circulating stem cells, and then you see within the first decade, you only have like a quarter left, and then it further deteriorates. But not only that, you also, during your lifetime, you are subjected to environmental hazards like toxins, things in your food. All of them can actually diminish the quality of your stem cells. So if you have bone marrow or adipose tissue-derived stem cells from a healthy 20-year-old, you would think they are in the peak of their lives, and therefore it is a good, suitable source for stem cells. But even a 20-year-old has been subjected to 20 years of environmental hazards and has gone through diseases, etc. So the stem cells are not quite what they used to be. Furthermore, there is a very important time in our lives, which is the time that we are born. And the reason why it's so important in this context is that there's a dramatic change happening. So before we are born, while we are developing in utero, there we feature like the absolute and unlimited potential for regeneration and repair. This is soon lost or immediate lost once we are born, because development is considered to be completed, and then it's just aging and growing. So it's no longer considered to be needed by the body. That is unfortunate, because we are not only losing the absolute capacity for total repair, but with age, as we all know, it further deteriorates, and regeneration takes always longer, is not as complete or as sufficient as it should be. So we want to harness that capacity of total repair and regeneration potential, and this is what we describe as zero-aged. So the mesenchymal stem cells that we harvest from the umbilical cord, they are created before the baby was born, so therefore they do have this capacity for total regeneration and repair still. And this is what we harness even for applications in aesthetics to achieve rejuvenation. So therefore it's so important to actually harvest the right amount, the right kind of stem cells that are zero-aged, and not to extend cultivation of those cells for the benefit of getting as many cells as possible, so that we retain this zero-age characteristic that has all those benefits. And this is how we actually do it. So all our cells are coming quality assured, and they are ethically derived from healthy births within the US. They typically come from C-sections to avoid any contaminations, birth-related contaminations by natural births. And the donors are followed up to 6 months prior to giving birth for their suitability. Then we collect those umbilical cords, and they get processed, and we harvest those cells. And at the end of our cultivation, we actually submit our cells to a CLIA lab for third-party unbiased testing against pathogens, and we do extensive validation and characterization of our cells and also of our exosomes derived from them. So I talked a lot about stem cells and less so exosomes, but this is actually the most important part, that you source your exosomes in the right way, that you utilize the most suitable source for them, cell source, and the most potent one, because only then you actually benefit from the potential that exosomes have towards our applications. So this constitutes the resilie difference. We are able to achieve a leap back in time with our H0 exosomes. That has been shown in applications, for instance, hair rejuvenation, where a middle-aged man noticed thinning hair on top of his head, and after just one treatment, 4 weeks later, we could see that there was more hair, that it was denser. But not only that, it was not only denser, but the patch that regrew denser was overall also darker. Given his age, being in the mid-40s, already had salt and pepper kind of hair, and where it actually regrew and rejuvenated, the hair was overall darker, clearly indicating that we actually can revert and go back in time. Another case was somebody with a bald spot of considerable size for over 3 decades, and it took a few more treatments to see a significant effect, but we noticed that the bald spot became smaller, just like when it starts, you start out with a small bald spot and then it grows in size, and for this treatment it reverted back, so the bald spot became smaller and smaller, and with fuzzy hair in the middle as well. So all of our results indicate that we can achieve serious rejuvenation with H0 exosomes, but with H0 exosomes only. I mentioned that we have a CLIA lab certificate and of analysis and conformity with every batch of our cells. So it's some 20 plus pages that gives you assurance of perfect quality and potency. We obviously use xeno-free and serum-free media for our cultivation, and our exosomes, also very important, and I cannot stress that enough, are never lyophilized. So a lot of other providers, let's say, lyophilize their exosomes for the benefit of longer shelf life. That sounds great, but unfortunately, exosomes are biologically active. If you freeze dry them, you actually destroy them per se. So we actually have checked on competitors' exosomes and reconstituted them, and we did not find a single exosome that was intact. So what you end up with is exosome junk that might do something good, because there might be a few growth factors that are retaining their properties, but overall you basically destroy them. It's I always like to say it's like freeze drying a steak, and then you pour some water over it and try to eat it, and with delight, it's not going to happen. And last not least, we adhere to very stringent US FDA manufacturing standards. I mentioned that we are deeply rooted in regenerative medicine. So when we started out our business, we actually approached the FDA proactively and asked for advice how we should do things and what we have to observe to actually work with them and not against them or them against us. And that led to a great report. We exceeded their requirements based on things that we found also important. It just is testament to the excellent quality of our cells and the exosomes that we derive from them. So before I hand over to Dr. Cicchetti, this is something that we actually pursue as applications in the field of aesthetics and cosmetics. So we look into options for exosomes therapy in conjunction with microneedling or after laser treatments, in particular with a focus on how it mitigates inflammation. Very important after these procedures that I just mentioned. We have seen great results in hair rejuvenation. We have also seen results in eczema, improving eczema and improving the appearance of scars. Scars is like one of those interesting topics where it's in between dermatology and cosmetics, so it's in between aesthetics and medical applications, really, because it depends on the wording that you use. If you want to treat a scar, it's a medical application. If you want to improve the appearance of a scar, it is a cosmetic application or aesthetics, even though it might be the same thing. I mentioned earlier that we are deeply rooted in regenerative medicine, and all our exosomes are actually having the quality of being applied in either. They have medical grade of superior quality and potency. And I hope I was able to convey to you during my presentation why that is and why we firmly believe those to be the best and most potent, best quality exosomes in the market.